Hey, MS Warriors, happy Friday. It is Maddie. Tonight I want to cover something that I've been experiencing um, probably for a good month now. But I've been going through a lot of testing, and that is basically about breathing problems, breathing issues, and multiple sclerosis. I had to write notes because it's kind of a lengthy topic. Most common cause of breathing problems in multiple sclerosis is loss of muscle strength and endurance. MS sufferers might have a weakness in the chest and abdominal muscles involved in breathing. The term that is used is dyspnea, commonly known as shortness of breath. People with weakened breathing muscles have to work harder to inhale and exhale. Breathing problems can also interfere with speech. You might find it harder and more tiring to carry on a conversation or speak loud enough to be heard, which is a problem that I experience quite a bit. The issues I've been experiencing for a while now, but lately have been more pronounced, is a shortness of breath, where I could be doing anything, trying to carry on a conversation. I found myself having to pause to catch my breath, and sometimes it's hard for me to bring my voice high enough to be heard. I recently have gone through pulmonary function tests and have been given a inhaler that I've used once a day. I do have albuterol if it gets super bad, but hopefully I won't have to. Hopefully this one daytime medicine once a day will help. I woke up this morning after being up for a little bit. I started wheezing. Started sounding like Darth Vader after a little bit. And I've also gone through cardiovascular testing, which I covered in my previous videos. Went for a cath test to check if I had any blockages, and there was none, fortunately, so I didn't have to get a stent. I just got a really nasty bruise that's getting better, but it's still pretty black and blue. But at least I didn't have to get a stent. I do have to take a baby aspirin once a day, as well as medicine for high cholesterol. And I am trying to get on a weight regimen, medication. But I'm still waiting for authorization from my insurance company, which is a real pain in the butt waiting. It's been 2 weeks now. But back to what I was working on. I kind of had a couple of things that I was working on that I stopped and started because of everything I've been going through the last couple weeks. Excuse me. Breathing problems can also interfere with speech. You may find it harder and more tiring to carry on a conversation, as I previously said, or speak loud enough to be heard. Other causes of breathing problems could be due to medications, such as anti-anxiety medications such as Xanax and Ativan, muscle relaxants, and opioid pain relievers. Uh, Fortunately, I don't take any of those that cause those problems. For me, it's mostly muscle and strength, and affecting my breathing, causing wheezing also. Um, Aspiration pneumonia is an infection that is caused by inhaling something other than air into your lungs. Could be liquid, could be food, uh, could be environmental. Uh, Never thought I'd be going through these issues. And then, excuse me, uh, multiple sclerosis also causes a thing known as the MS hug, which can feel like a boa constrictor or a relative at a family reunion that squeezes you too tight and you can't catch your breath. MS hug is caused by nerve damage in the spine and spasms of the small intercostal muscles between your ribs. Symptoms: the sensation varies widely from mild discomfort to intense, sometimes debilitating pain. I don't know how many of you out there who've had a MS hug, but they could be really painful. Um, so I'm thinking, I'm not a doctor by no means, um, that all these heart and lung testing I've been going through, I think could be related to the MS hug, seeing that there was no blockage in um, my heart, in my arteries, and they didn't do a stent. And then most of my respiratory, the pulmonary perfusion test came back. The levels were pretty much normal. A couple of them were low normal, but they were still normal. Um, so a lot of this could be partly is due to the MS, multiple sclerosis. I went to the MS doctor last Monday, and she said that my MS has gone from being RR MS, remitting relapsing, to secondary progressive. So it is getting worse. And also on the MRI of the thoracic spine I had not too long ago showed that I had a hemangioma on the spine, of the partly of the thoracic and lumbar spine, and I think that could be causing part of the issues as well. I really love doing these videos, and I haven't done them the last few weeks, partly because of everything I'm going through, and partly I feel kind of discouraged. So anybody who has MS out there, let's pull together and talk about some of these issues that you guys might be having as well. Maybe you're having stuff that's similar to what I've been going through. I'd be curious to know. Please comment. If you like my comment, like my post, please leave a heart. If you know anyone that experiencing multiple sclerosis or lost my train of thought, sorry. Please subscribe to my channel. I am just kind of off tonight, but I do plan on coming back, hopefully sooner than later. All right, talk to you later. Take care.